Hello, my name is Jennifer and I'll be you guys' nurse educator for today. Today we're going to be going over a few risk factors for falls so that we'll be able to address how to prevent them at home with Margaret. Our goal today will be for your family to be able to identify those 3 modifiable risk factors so that by the end of our discussion you'll also know how to prevent them at home. How does that sound? Before we start, do you have any questions for me? Okay, not at this time? That's fine. So I'd like to start by having you tell me what you know about falls, causes, and preventing them. Okay, so from what I'm understanding, you know that falls can be harmful and scary, but you're not really sure what you can do about them, as they kind of seem like the inevitable part of life. Well, that is actually a great realization. Falls can be very harmful to us, or even Margaret, but they don't have to be inevitable. Let's start with a quick look back. Let's think of a time that you may have experienced a fall or may have even witnessed a fall. When you think about this, I want you to answer these following questions. What was happening around at the time of the fall? What was the activity right before the fall? When the fall occurred, what did you see around their feet? Could have anything that was ingested or drank be the cause of the fall? Were there any concerns regarding mobility or gait right before the fall or at the time of the fall? Did the person have a fear of falling at the time of the fall? Perfect. So by answering these questions, you actually unknowingly identify 3 factors that we can speak about today, which is balance and gait, vision, and medications. When balance and gait are compromised, it can increase our risk of falls. Gait is a controlled and very high attentive task. With vision, imagine if we had to walk around with our eyes closed all day, we'd definitely be bumping into things and tripping. And lastly, with medications, there are some things that can affect us and cause us dizziness or drowsiness, even like simple as cough medicine. Therefore, they increase our risk for falls. With Margaret dealing with dementia and her surgery, her balance and gait is going to be a little bit off, especially with the dementia changes, as it makes it very hard for her to achieve the attentiveness required in order to have good gait control. The medications also that are used to help with the disease process of dementia also contribute to a high risk of falls. Ways we can decrease this risk. So regular exercises. An example of a regular exercise that can be done that is very simple are something called ankle pumps. If Margaret's lying down for a while, or she's been sitting for a while, then she can just do a couple of ankle pumps to kind of get the blood flowing before she stands up so that she avoids getting dizzy or feeling off balance. You also want to make sure that there's always adequate lighting in a room. If you want to walk somewhere, you want to make sure that you're able to see where you're going. Another thing for vision is you want to promote regular vision checks. With our eyes, yes, we can do a lot of things by keeping the room lit, but if our eye vision is not good, then that's another risk factor. Speaking with a pharmacist and reviewing her medications is another great way to reduce her risk of falls. Because if you understand the effects medications can have to falls, then you know how to take the proper precautions or safety measures in order to prevent her from falling. I'm going to give you this handout. This handout looks over the 3 modifiable factors that we just spoke about. As well, I'm going to give you a link that also talks about 6 fall prevention tips. So right before you're discharged, I know we went through a lot of information, but I want to ask you, what are the 3 modifiable risks that we spoke about? Perfect, that's correct. So we spoke about balance and gait, vision, and medication. Can you tell me a couple of things that you can put in place so that you can reduce the risk of falls for Margaret at home? That's perfect. You can promote and encourage regular exercise. You can make sure that a room is well lit whenever you want to ambulate. You can also promote regular vision checks. And then you can speak to a pharmacist regarding her medication so that you know the increased precautions you can take to protect her from falls. So now that we've gone through that, like I said, I know it was a lot of information. Do you have any additional questions for me? Okay. If you feel like you have any questions later on, you can always refer to the handout or watch the video like I mentioned. Or you can always book a visit with her doctor or with another nurse educator who can also go through the fall prevention tips that I went through or even more. Thank you so much for talking with me today. I hope you guys have a wonderful day. Bye-bye.